If everyone could take their seats, we're going to get started. We have an opportunity to thank our platinum sponsor, Cheryl DeMars, the CEO of the Alliance. Cheryl is president and CEO of the Alliance, an employer-owned cooperative based in Madison. Early in her career, Cheryl was a contestant on The Price is Right. How awesome is that? Plinko, super jealous. Today, she uses her purchasing savvy to help 240 employers who self-fund their health plans get more health and better health care for their money. Please welcome Cheryl.
Thank you. So how many people here get their health insurance through their employer? Let's see a show of hands. Put your hands up if you get your health insurance through your employer or your spouse's employer. And keep them up if you think health care costs too much. Looks like it's unanimous. And that is why we are so excited to be part of Disrupt Madison, because if there is one thing that needs to be disrupted, it's healthcare. And one of the most promising and underutilized forces for change is right here in this room, and that is the employer community. We see incredible variation in the cost of healthcare, and employers, we're buying the majority of healthcare in Wisconsin. We're paying the money, we're spending the money for health care. And we're also spending about a third of that on care that's of poor quality, that's wasted, for things like tests and procedures that we get but don't need, or complications that could have been avoided. We also see crazy variation in the price. Right here in downtown Madison, Wisconsin, you can pay $4,000 more or less for a knee arthroscopy depending on whether you make a right or a left turn off of the elevator. Turn left, it's $8,000. Turn right, it's $12,000. What if we as employers started buying healthcare differently? What if we insisted on knowing the cost and the quality, and then use that information to send our business where costs are low and the quality's good? I believe in the power of employers to make a difference in healthcare because I've seen it work through our cooperative. So let's make a commitment to do our part to disrupt healthcare. We owe it to our employees, we owe it to our businesses, and we owe it to the healthcare system, because healthcare won't change. Healthcare can't change without us.